John Gonzalez of San Antonio is a car buff. He likes working in his driveway, fixing up old classics. These days, he's a lot more comfortable being out here with a muscle shirt on. John recently had liposuction to change what he said was a shape he couldn't stand anymore.
As a youngster, it bothered me a lot. Every time I would either take off my shirt or whatever and stuff, I would kind of get little criticisms and comments about, hey, what's wrong with you, you know.
There are many causes for enlarged male breasts, like weight gain. That's the culprit in the majority of cases. But doctors say hormone problems, steroid abuse, and even marijuana use can increase breast size in young men. San Antonio plastic surgeon Thomas Jeneby has performed breast reduction on boys as young as 13.
It's a huge problem for some of these kids. They play basketball and they have these breasts, and their teammates ridicule them. And that's actually the #1 reason they come in, is a sport-related ridicule.
For Gonzalez, who waited until his 40s to do something, a procedure called smart lipo was the answer. In an office under local anesthesia, the doctor uses a heating element to shrink down the area and dissolve the fat. Patients with more complicated cases or who need actual breast tissue removal may end up here in the operating room. Surgeons can do most of the work through small cuts that won't show up later. In a culture that's increasingly body conscious, more men and boys are willing to investigate a surgical solution for more sculpted pecs. Just a few years ago, only 5% of plastic surgery patients were male. That figure's changing. Now, 11 to 15% of all plastic surgery cases are men. Here are some of Dr. Jeneby's before and afters. A young teen, before on the left, and then after. An older man, before on the left, and then after. Dr. Jeneby says patients recover quickly.
They get back on the horse very quickly, and they get back to doing what they're doing, and they're less embarrassed. After being worked up effectively, ultrasounds and endocrine workup, then I think that this is going to be, men are going to be coming out of the woodwork to get things done.
John continues working out to make the most of his new silhouette. He says he's glad he had the work done, and he's happy to have a more manly-looking chest. Wendy Rigby, KENS 5 Eyewitness News.